Welcome back, beautiful humans, to the show that keeps finding new and creative ways to tell you that less is more, and apparently will never run out of material. You are listening to the AI avatar of Dr. Irina Lazuk, dermatologist, skin scientist, and the woman who would like to gently but firmly intervene in the way you have been interpreting the phrase sensitive skin. Dr. Lazuk is not available today because she is currently somewhere in the Finnish wilderness, having accepted an invitation to a Nordic skin and wellness symposium that required a 40-minute helicopter ride to reach and apparently has no departure scheduled until next week. She describes the location as breathtakingly remote and genuinely clarifying. The symposium organizers describe her as the only attendee who arrived with a full research agenda and a thermos. She has already submitted 3 pages of notes on how cold water immersion affects barrier recovery. She is having the time of her life. We will see her when the helicopter returns. So, you have the avatar, and today we need to address something that Dr. Lazuk hears constantly from patients in clinic, from people in online communities, from anyone who has been paying careful attention to their skin for the last few years and arrived at a conclusion that feels both alarming and inevitable. I think I have developed sensitive skin, and they are not saying it casually. They are saying it after months of careful research, after switching to gentle products, after reading every label, after doing everything the responsible corners of the internet told them to do, and yet their skin is reacting, stinging where it used to tolerate things easily, flushing without obvious cause, tight 1 week, unpredictably reactive the next. Products that used to feel completely neutral now feel like they are starting arguments. And the conclusion is, something fundamental has changed about my skin. My skin is sensitive now. This is just who I am. Here is what Dr. Lazuk needs you to hear very clearly. True sensitive skin, the genetic, structural, deeply rooted kind, is actually relatively uncommon. What is extraordinarily common right now, affecting an enormous number of people who carefully research their way into this situation, is something completely different. It is called sensitized skin, and the difference between those two words is not a technicality. It is the difference between a permanent condition and a temporary state, and states can be reversed. Sensitized skin is not what your skin is. It is what your skin is doing right now in response to an environment that has asked too much of it for too long. And here is the deeply uncomfortable irony at the center of this whole situation. The environment that created it was not negligence. It was not harsh products or careless habits. It was care, enthusiastic, well-researched, genuinely well-intentioned care that quietly crossed a line. Here is how it happens. You start paying attention to your skin. You learn about actives. You add a vitamin C. You add an exfoliant. You add a retinol. You learn about barrier damage and add ceramides to protect the barrier. You learn about the microbiome and add a probiotic serum. You learn about inflammation and add 2 calming products. You learn about hydration and add 3 humectant layers. Everything you added had a reason. Everything was labeled gentle or barrier safe or dermatologist tested or soothing, and your skin experienced all of it as noise. Because skin does not read labels, skin receives signals. And when signals arrive constantly, different pH levels, different active ingredients, different textures, different instructions all arriving in the same window, the skin does not politely sort through them and select the most beneficial ones. It gets overwhelmed, and overwhelmed skin responds with inflammation, not the dramatic kind, the low-grade, persistent, confusing kind that makes things sting that did not used to sting and flush for no obvious reason and react to products that are technically completely gentle. That reaction is not sensitivity. That is your skin telling you it has had enough input and needs the conversation to slow down. There is also something worth saying about the language problem that made all of this worse. Words like repair and soothe and barrier safe and microbiome friendly have become so reassuring that people stopped questioning whether to add them and only questioned which ones to add. They sound inherently non-threatening. They sound like they cannot possibly cause problems, so people stack them. Multiple calming serums, multiple barrier creams, multiple repair products, all simultaneously. On top of exfoliation that is not actually stopped, it has just been relabeled as resurfacing or renewal and feels gentler, so it does not count. It counts. It all counts. Every product is a signal. Even the kindest, gentlest, most carefully formulated signal still asks your skin to process something. And when too many of those arrive at once, the skin does not optimize. It braces. There is also an emotional dimension to this that deserves to be named because it sits underneath everything else and nobody talks about it directly. When sensitization happens despite doing everything right, people feel like they failed. They followed the advice, they avoided the bad ingredients, they invested real time and real money and real attention, and their skin reacted anyway. That feels personal. It feels like a betrayal, and that frustration tends to push people towards switching products more frequently, trying to find the thing that finally works, which ironically deepens the sensitization cycle because the skin never gets enough consistency to stabilize. So let's be clear about this. Sensitization is not a moral failing. It is not evidence that you are bad at skincare. It is feedback. Your skin is adaptive and it is telling you something very specific. It is telling you that the input volume is too high and it needs the noise to stop. Here is what recovery from sensitization actually looks like. And you need to know this in advance because if you do not, you will abandon the process right before it works. Recovery does not look like improvement at first. It looks like less. Less reactivity on days when you expected a reaction. Fewer inexplicable bad skin days. A gradual return to predictability. Products starting to feel neutral again instead of confrontational. The stinging stopping. The flushing settling. None of that is dramatic, none of that photographs well, but that return to predictability is not a consolation prize. It is the foundation. Tolerance is rebuilt through stability, not through finding a gentler version of the same excessive routine. And once tolerance is rebuilt, the skin becomes cooperative again in a way that actually lasts. The question worth asking, and Dr. Lazuk considers this one of the most useful reframes in modern skincare, is not, is this product gentle enough? The useful question is, does my skin need another signal right now? And for a significant percentage of people reading their skin honestly, the answer to that question most of the time is no. Not because skincare is bad, not because actives do not work, but because the skin has received enough information for now, and what it actually needs is quiet. Consistent, boring, unglamorous quiet in which it can remember how to function without being managed every single day. Your skin did not become sensitive, your skin became overwhelmed, and those two things require completely opposite responses. Sensitive skin needs permanent accommodation. Overwhelmed skin needs temporary simplification and then time. Real time, not 14 days. Actual time. The bigger shift happening right now in skincare is not toward sensitivity, it is toward recognition. People are finally noticing that their skin is communicating and starting to learn how to listen. Learning to distinguish between a signal that means add something and a signal that means stop adding things is the single most valuable skill in long-term skin health. And now you have it. Before we close, everything you just heard is purely for entertainment and educational purposes only and does not constitute medical advice. Sensitized skin, barrier function, and skin reactivity are all real clinical topics that deserve real professional attention. Please consult a licensed dermatologist for guidance specific to your skin and situation. Dr. Lazuk will be accepting consultations again as soon as the Finnish wilderness releases her and the helicopter schedule cooperates. May your skin always glow as brightly as your smile.